Good afternoon, and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna, and I am your host. Some of you will remember Dr. Jana Lubrano talking about general surgery and not too long ago, and we welcomed her back. And the reason we're here in summer, we're in Texas, skin lesions, skin moles, and stuff that we need to have looked at and stuff. And it's where do we go for that? What do we do? So we've invited Dr. Lubrano back because she can give us another take on that. When you think of general surgery, you kind of think of gallbladders and appendix and hernias and those kind of things. But did you know that general surgery can also do skin lesions? So, Dr. Lubrano, I'd like you to speak to that.
Sure, no problem. Thanks for having me again. I'm so happy to be here. But I think the first thing that I want to clarify is to make sure that everybody understands what a skin lesion is. They hear lesion and they're like, ooh, what is that, right? So a skin lesion is basically just a blanket term that we use, and it just refers to any skin abnormality. So more specifically, it's a part of the skin that has an abnormal growth or appearance compared to the skin around it. And this can include anything from moles to beauty marks, cysts, lumps or bumps, or even skin cancers. And there are certain circumstances where some of these types of lesions can or should be removed. And this is something that general surgeons, such as I, can do. And conveniently, a lot of these removals can be done in the clinic with local numbing. And you could be in and out in the same day. Most require a big surgery with general anesthesia in the operating room or anything like that. So that is definitely something that's, included in my practice.
Awesome. So we all get lumps, bumps, and funny looking things on us. But if they're not bothering us, should we still have them checked out or do something about them?
Well, that actually depends. So typically, if a lump or bump or mole is not bothering you and not causing you any pain, then it doesn't necessarily have to be removed. But there are a couple circumstances and a couple reasons for removal. One of the common reasons would be for cosmetic reasons, of course. So people don't like this ugly mole or lump on them, so they like that removed, which is fine. But the other more pertinent reason that I need to make sure that everybody understands is that if this lesion is concerning for cancer, that would absolutely be a reason for removal. The majority of cancerous skin lesions are typically painless. So even if it's not bothering you, it's not causing any pain, it could still be concerning for cancer because a lot of these cancers don't cause any pain. So if you have a growth, lump, bump, or mole that you're unsure about, I encourage you to come see me or your primary care physician so they can, take a look at it and decipher for you if they think the skin lesion is concerning or not. And I think that this is a good point for me to bring up something, and you may or may not have heard of this, but it's called the ABCDE rule. And this is just an acronym, and it helps us to identify melanomas, which is also, a medical term for a very serious kind of skin cancer. And there are certain characteristics, sun damage and skin damage, that doctors can look at when diagnosing or trying to classify these melanomas. And what it stands for is A stands for asymmetry, B border, C color, D diameter, and E evolving. So just briefly going through each of these. So any mole that you have that's asymmetrical, meaning that it's not a uniform shape, it's different on each side, that's something that you definitely need to get your doctor to look at. If the borders are not well defined, if they're irregular, then that could potentially be a cancer. Usually non-cancerous moles have more of a smooth edge or well-defined border. Color is C, color. So a melanoma or a cancer typically has multiple different colors or shades within it. It's not one uniform color. So if you see that, you need to come in. The diameter, so 6 millimeters is a diameter or cutoff that we look at for being concerning. So 6 millimeters is about like the end of the eraser of a pencil. So you kind of compare that way. And then the last thing is evolution. So melanomas often change in their characteristics, their size, shape, and color. So if you see it evolving and changing over time, that is typically not normal for a mole. So that definitely needs to be looked at. Something that's benign will kind of sit there. You'll see that same mole there for years and years and it never changed. So That's the ABCDE rule. This is something that doctors use, but you can definitely on yourself kind of, if you want a quick look at yourself, have a spouse or family member look and see if there's anything that matches that criteria.
So sometimes I think we get busy. We don't pay enough attention about this until it becomes bothersome. Is there just like an age range where it's just a good idea to be examined? Like your back, your legs, some of those places where you may not see or feel anything.
Yeah. So the thing with these, you may have heard of skin exams. So there is no consenting or consensus on guidelines of who has to get yearly skin exams where the doctor looks at you from head to toe. There are circumstances where this is required for people who are high risk, who have had other kinds of cancers, family histories, things like that. But for somebody who has, is an average risk for cancer, there's no real guideline for it. But what I recommend is that, especially if you're a light-skinned person, a lot of times redheads even, they get a lot of moles and things like that. If you create a lot of moles, light skin, you burn easily in the sun. I would start, as early as 50 years old, just get your yearly skin exams. There's no really set time to do that. Or if you have a family history of cancers, or in general, if you're always out in the sun, that is definitely something that I would look into. If you're not able to check yourself, have a doctor look for you. That's definitely something that can be done in the office.
And I would think when you went to your annual physicals and stuff, I would hope that your physician would kind of check things. If they're not, maybe ask them.
Yes.
Or if not, Dr. Lubrano, you can also help them.
I can help them. Absolutely. So that's something to bring up too, because you may go get your physical exam and the doctor doesn't really do a skin exam. And that's because it's not necessarily, a baseline part of a typical physical exam. But if you ask them and say, hey, look, I'm in the sun a lot. I'm worried. I want to make sure these moles are okay. Will you take a look at my skin? I'm sure they'd be happy to. If not, then you come around to see me or even a dermatologist.
So there's a lot of us that tend to want to remove our own things at home or mess with them. Is that safe? Is that something you think people should be doing?
You mean like a cyst or a boil or something like that, popping those on your own? Yeah. The simple answer to that is no. And the reason, and I know it's tempting to, but the reason being is that if you have a cyst or an acne or, a boil or something like that, and especially a cyst that is not already infected, once you try to squeeze it and pick at it, what you're doing is you're introducing bacteria into that wound, and you might actually end up with a much worse infection or major problem that you didn't have before. So, and it could also, let's say you have a boil and you want to try and lance it yourself. You could be causing undesirable scarring because you're not a professional. So, I would not encourage doing that. So the other issue is that if you do this yourself, you may not adequately drain the infection. The infection or issue becomes a longer lasting problem that you'll end up having to go to the doctor for anyways. Sometimes you might need antibiotics that the doctor has to prescribe for you. So I really do not encourage you picking at your own skin. And if it's something concerning, and you feel like it needs to be lanced, just go to your doctor. It doesn't have to be an emergency. Come, schedule an appointment in the clinic. You could come see me and I'll be happy to take care of it for you. We use a sterile technique. So this will help prevent introduction of any bacteria.
So I have a confession. I had a 30-year-old cyst that I had been pushing and pulling and everything on. And Dr. Lubrano, I actually came and saw you and had it extracted. And I have to tell you, it was brilliant. She had a wonderful job. It healed really fast. And I wished I wouldn't have waited 30 years. So I do ask that people come in because I even had a little blood clot in the middle of things because I'd been pushing and everything else. So from someone that did procrastinate and try to do it themselves, I'm encouraging everyone go see Dr. Lubrano because it's not worth what could have happened.
Right.
So someone has a lesion and everything else. How do I determine? Do I need to go to a dermatologist or I need to go to someplace else? Because dermatology is kind of hard to get into.
Yeah, there's not many dermatologists around. So that is something that I could definitely take care of for you, or general surgeon. Not all general surgeons will typically, deal with skin lesions or skin exams. Some do. I'm definitely one that includes that into my practice. It's a good portion of my practice. So I'm happy to see anybody who has a skin lesion, even if it's something that you're like, it's small. I don't really think it's a big deal and I'm not sure. Still come in and see me and I can help you delineate that. That's not something that you should burden yourself with. A dermatologist is also somebody who sees these issues. So that would also be an appropriate place to go if you have your own dermatologist. But I am definitely happy to help you with any skin lesions or issues.
And what if I have a cyst or that has ruptured already? Is there still a reason to see the doctor?
So a cyst that is ruptured is not necessarily an emergency, but I do still encourage you to see a doctor, at least in the outpatient setting, just to ensure, number one, that it's not infected, because if it is infected, you may need antibiotics and further drainage. But also, if it is just a simple cyst and it's drained on its own, typically, just because it's drained doesn't mean that the cyst is taken care of, because the cysts do have a sac within it. There's a little special sac that allows that cheesy material to develop in it. And even though the cyst is ruptured and it's drained out, it's going to keep coming back until that sac is removed. So that's what the surgeons do, is make sure not only that material is squeezed out, but also that sac is removed so that you don't keep getting this recurrence of a cyst and increase your risk of future infections and stuff like that.
Okay, and what about carbuncles and boils? And what is exactly a carbuncle?
Yeah. So first, I'll address what a boil is. So basically, a boil is just another name for a small skin abscess or infection. And a carbuncle is like a cluster of boils. And typically it's caused by a staph infection. So this is an infection that contains pus and typically needs to be drained by a surgeon or surgically drained. So this definitely needs to be looked at by a physician. If the infection is very large and it's associated with fevers or chills, I even encourage you to go to the ER so that the doctor can drain it right away, because we want to avoid any spread of this infection into your bloodstream. There are cases, so there is a special circumstance where boils may not be a surgical issue. And this is if you have boils that keep coming back and you get them drained and they keep coming back, the infection never clears. And in that case, and you'll see these typically in the armpits or in the groin area, and there is a skin disease called hidradenitis suppurativa, and I actually see it quite often in my office. And this is a condition where you get multiple drains, multiple abscesses, fistulas that connect, there's pus that's always draining out of them, and they keep getting these surgical procedures, and it's actually exacerbating or making the problem worse. In this case, the treatment for this issue are special medications, antibiotics, and even biologic agents. And that's something that a dermatologist treats. And I see it a lot in my practice because it's often misdiagnosed. I'll see a patient in my office, I'm able to detect and see, this is not a typical abscess. This is hidradenitis. This is something that needs to be seen by a specialist to get medical management, because surgery will actually make it worse. So if you recognize, that sounds like me, I get multiple drains and cysts, draining abscesses in my armpits and groin, or even on my scalp, that could be this disease. And you could still come to me. I'll still assess it for you and make sure you get to the right specialist, if that's the case.
Great. So we've talked about having the skin abnormalities and the cysts and the boils, but let's talk about the prevention of it.
Yeah, sure. So, since we're on the topic of skin and we're right in the midst of summer, I'm sure everybody's looking forward to fun in the sun, which is fine. It's okay to be in the sun, but it's extremely important to remember to protect your skin from the sun, because this is the leading cause of skin cancer. So please, 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 please wear your sunscreen. I cannot stress more how important it is that sunscreen is. Doesn't matter what skin tone you are, doesn't matter how easily or not easily you burn. You have to wear sunscreen, SPF of 30 or greater. Apply it every 1 to 2 hours. Don't forget to, rub the sunscreen on your eyelids and lips and even the backs of your hands, because this is very key to preventing skin cancers.
And Correct me if I'm wrong, Dr. Lubrano, but aren't there some medications that help you burn faster too in the sun, or are more sensitive to the sun?
There are some antibiotics that can make you more sensitive to the sun. So I would definitely, and there's a couple of them, I would definitely make sure and ask your pharmacist any medication that you're prescribed. Is this something that I need to stay out of the sun for? And they will let you know that. And a lot of times it'll be directed on your prescription. Yeah.
Okay. And then we see not just kids, people that really want this nice tan. They go and do the tanning oil.
Yeah.
And go lay out.
Not a good idea. Not a good idea. So this is definitely, and I know it's nice, it makes you look nice and tan skin, but it's not a good idea to go out and absorb all those UV rays without a sunscreen on. You know, if you want to get a little bit of sun, get a little color, that's okay. Just make sure you're applying, even if it's an SPF 30, you'll still get some tan from an SPF 30, but you got to wear it and reapply it every hour. I mean, it's not only to prevent cancers, you're also preventing, moles and barnacles that grow on your skin just from the sun damage, and also wrinkling that'll prevent aging as well. So, but definitely.
So we want to plan ahead.
We want to plan ahead. That's right.
Okay. Are there anything else that we need to know about skin? Because this is, I don't know that it's something that we're all very diligent about doing. And I had a very good friend that died from a melanoma that she thought was just a little spot on her leg, and it didn't take long, and it was very unnecessary.
It's a very aggressive cancer. Our skin is the largest organ on our body, and it tends to be somewhat neglected when it comes to our health, right? And unfortunately, we don't have good guidelines for skin exams where the insurance will cover your skin exam every year, kind of like they do a colonoscopy. So I think it's important that we put on ourselves the diligence of making sure to look at your skin, have your loved ones look at your skin. I mean, melanoma is a devastating cancer, and it's more common than we think. And we're all in the sun all the time. So we're all at risk for it. So I cannot stress how important it is to check your skin, and the prevention of it is even more important. You could prevent this, and you could prevent it with just putting some sunscreen on or wearing long sleeves when you're going out for, to do the yard work or whatever. So just be diligent and make sure you're paying attention to that.
I agree. Dr. Lubrano, it was wonderful having you here. Is there anything else you want to say in closing?
No, I'm just so happy to be. And everybody out there, if you're from the Richmond, Rosenberg area, even Sugar Land, Katy, come see me. I'll be happy to take a look at your skin or any other surgical issue that you may have.
And I understand, Dr. Lubrano, you also do colonoscopies.
I sure do.
So for those looking for a female and want someone to help with their colonoscopies, Dr. Lubrano is also able to do those.
Yep.
And I will tell you, after seeing her as a patient, it's a very pleasant and great visit. So I encourage everybody, get your skin checked, do what you need to do, and take care of yourself. It's a hot summer, and we want to make sure everybody's here for a next one. So I want to thank you, Dr. Lubrano, for joining us today, and a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.